Hi, my name is Leo and I'm a physiotherapist practicing in Canada. I fully ruptured my Achilles tendon about 3 weeks ago, and I have made one video already to describe my experience with the injury and my decision to go with surgery so far. And in this video I want to just make a quick one to follow up on my first one and to tell you more about what I'm doing right now and how I'm managing. So the first thing I want to talk about is the cast. So right now I have a cast from just below my knee all the way down to my toes, and there's just a little bit of wiggle room, but I can't move a whole lot, and it's quite heavy, so it's kind of bulky to deal with and it makes it tough to walk. But with the help of the knee crutch that I showed in the first video, I'm still able to walk and do my work in a limited capacity. And so I obviously wouldn't do anything physical that would put myself or my patients in danger. But it's nice to be able to do a bit of work still and not be at home for most of my time. My main goal with my rehab is to be able to play tennis again. And so all my efforts will be concentrated towards achieving that goal throughout the whole rehab process, which will take about a year. And I play at a recreationally competitive level. I don't play for any fame or glory or prize money, but I do enjoy playing tennis and competing a lot. And so I'll be spending as much time and effort as I can to get back to the level I was playing at before. In my last video I mentioned about using a muscle and nerve stimulation device at night to help with my circulation. So I just took a quick video of how it works today. You can see on the right side here that I have a couple of electrodes on my thigh, and depending on the size of your leg you might need bigger electrodes, but the idea is that when the muscles are contracting, it's going to help with the circulation and reduce swelling. I want to provide a quick word of caution about using the iWalk 2.0 knee crutch. Because you have to strap the knee crutch to your leg quite tightly in order for it to be secure on your leg, it could cause some compression of the blood vessels going down your leg and also the nerves too. So if you are going to be using it for a long time, say over an hour, I would highly advise just taking a break often and releasing the tightness of the strap every now and then, say about every 10-15 minutes, just to make sure that you don't make your leg go numb or restrict your blood flow, because especially after you have surgery, because one of the risks of having surgery is a blood clot, and you definitely don't want to restrict your blood flow. So I can't do anything about my ankle just yet in terms of range of motion and strength because I'm still in a cast for a few more days. But I could work on my hip and knee strength in the meantime. And that's important to do because when you're not weight bearing, all the muscles that you normally use for walking are not very active, and they get weak over time. So I'm going to show you a few things now you can do to maintain the strength in your hip and knee the best you can while you're in a cast and you can't weight bear. So the first thing you can do is called a straight leg raise, and it's exactly as it sounds like. You bend your unaffected leg and you have your injured leg straight, and you're going to keep the leg straight during the whole movement, and you're just going to simply raise your leg up, keeping the leg straight up to about a 90-degree angle of the hip, and then bring it down nice and slow. So about 3 seconds to go up and 3 seconds to go down. And you can do that 10-15 times, 3 sets twice a day. Another exercise I recommend doing is called the clamshell. And with this, you're going to lie on the unaffected side, and you have your legs stacked on top of each other, and your knees bent about 90 degrees, and your hip bent 45 degrees. And you're going to keep your feet together, and you're just going to lift your top knee up from the other one as far as you can go without turning your back. So your back stays straight, and you bring it back down, taking about 3 seconds to go up to the top and 3 seconds to go down to the bottom. And you should feel the muscle in your buttock area work when you do this movement. So 3 sets of 15, or 3 sets of 10 to 15 twice a day. A third exercise you can do for your glute strength is to do something called bridging. So what you're going to do with bridging is lay flat on your back. You're going to place a roll or a stack of pillows under your thigh. And then what you're going to do is squeeze your bottom and push your hips up towards the ceiling. Hold it there for 3 seconds. And then back down onto the bed. And make sure with this you don't try to arch your back. So all you're doing is tightening up your bottom, lifting your hips up, count to 3, and then back down onto the bed. Okay, so I'm gonna have my cast taken off in just a few days, and I'm really looking forward to that because then I can show you what I do for improving range of motion, swelling, and how I manage my scar tissue. And I'll probably post another video sometime next week to show you those 3 things. In the meantime, if you have any questions, feel free to post them. And that's going to be it for this video. So thanks for watching. We'll see you in the next one. Bye.